Hi, this is Dr. Sonia Nayyar from High Desert Neurology. I'm a neurologist in Apple Valley and I'm affiliated with Choice Medical Group and Horizon Valley. I wanted to talk today about COVID-19 and a topic that's very important to me, mental health. So I know a lot of us have gone through a lot of emotions now that it's been greater than 2 months that we've been sheltering in place. And a lot of it, I know, includes stress, anxiety, depression, some of the above, or maybe even all of the above. And I want to talk about it because it's okay to feel this way. A lot of us are going through drastic adjustment periods between both adults and children. And dealing with our mental health is equally as important as, let's say, you would take a medicine for your high blood pressure or diabetes. So I want to focus on some things that we can do to try to help our mental health during this time. So I want to go over a few non-pharmacological ways to deal with it. My favorite is deep breathing. It's something that you can do if you have a spare minute even. I tell people you can go into your bathroom, close the door, you can close the door in your closet, you can do it in the car while driving. All it takes is taking a deep breath in, holding it for 5 seconds, and then a deep breath out. And you can repeat this multiple times throughout the day, and sometimes even getting a 30-second break to do a few deep breathing techniques can really help you. The next thing I want to talk about is meditation and yoga. Nowadays, it's quite easy to find free YouTube videos, apps that can show it. I have no affiliation with it, but use Headspace app, which had some great meditation techniques, even for sleeping help, and even had some for children, which I thought was quite interesting. Next, my favorite is exercise. Getting up and just moving really helps our mental health. I know it's hard when we're being restricted how much we can go to the gym or even outside in the park, but you can always do a little bit exercise at home. I tell people you can get water bottles, use them as weights, you can walk around your room, walk to the mailbox back and forth, and you can even, if you're up to it, take a few friends and observing social distance, go walk in a park or walk down the street on opposite sides. So there's a lot of ways to practice that as well. Other people might find peace and relief in listening to music, reading books. If you're a religious or spiritual person, reading your religious book or even reaching out to spiritual leaders like rabbis and priests can be very comforting during a time like this. I also encourage that if you do enjoy writing into a journal to kind of get out some of the feelings that we feel as well. And even talking to people, talking to friends, family, whether it's via email, the good old snail mail, phone, texting, video chats, staying connected really helps you at this time. But there's a such thing as staying too connected with the world. So a lot of people have noticed an increase in stress and anxiety when they're watching the news or reading Facebook, Instagram, or all these things, because a lot of the news is centered around COVID-19. If you feel like that's contributing to your stress, take a break. Step back, turn off the TV, go outside for some fresh air, deactivate that Facebook for a little while, because sometimes that can add to the problems of your mental health. And lastly, if you try all these things and they don't help, talk to your primary care doctor, talk to a psychiatrist. There are a lot of people out there who can help, and if you need it, even some medications that can help during these trying times. Lastly, I want to talk about children. A lot of us, whether we have children, grandchildren, nieces, nephews, neighbors, have seen a change in children. And children don't exhibit stress and anxiety the same way that we do. When we get stressed, our blood pressure goes up, our heart rate goes up, we may feel dizzy, or in the neurology world, we see an increase in headaches when we're stressed. But kids sometimes show different changes. They don't have as physical of the manifestations that adults do. You can see a lot of change in behavior. There can be mood swings, temper tantrums, children becoming withdrawn, eating changes, sleeping habits that have changed. So keep a lookout for kids who are exhibiting these signs. And if you do notice it, talk to them. Children are quite aware of what's going on in the world nowadays, and talking to them about what their fears are might surprise you and might be able to help with that anxiety that they're having. And another thing that I found children are great at is drawing what they're feeling. And if they're older, encouraging them to do journals or diary entries about what they're feeling. And lastly, if that's not working, talk to your pediatricians. Pediatricians are here to help their patients get through this time as well. So I just want to remind everyone that take care of your mental health. It's just as important as your physical health. And if there are ways that you can't do it at home through the help of friends or family, reach out to your primary care doctor, reach out to your psychiatrist and your pediatrician to talk about what to do. And remember, just be kind. A lot of us are struggling in ways that we may not see, including physical and mental ways. So please be kind to everyone, and we'll get through this together. And once again, this is Dr. Sonia Nayyar from High Desert Neurology. Thank you.